Rural America, Successes and Challenges. We're going to share a brief housekeeping slide with you just to remind you of a couple of items. All attendees are muted, but can raise your hand or type in the chat. If you'd like to ask a question, please put that in the Q&A. We will address those at the end of the presentation if time allows. Just as a reminder, if you want to receive CE credit for the session, please complete the survey that will be shared in the chat at the end. Survey links will also be emailed out to all the attendees. And when the session ends, attendees will be automatically routed back to the lobby to choose the next session. So you can go back and choose the next one on your own. I just wanted to share before we get started with our speakers to share some of the objectives for today's session. First objective is that we will express how a rural teaching health center's dental residency impacts both patients and the community. We'll be able to describe how a mission-centered residency training program impacts a dentist's career. And third, we will understand the advantages of a community health center developing a residency program, the scope of work required, and the assistance available. So I'd like to welcome our two speakers for today's session. We have Dr. Jade Duncan and Dr. Mark Koday. Dr. Duncan is an educator, learning leader, motivational speaker, author, and thought agent who currently serves as Chief Executive Officer of the Dr. Jade brand, LLC. Dr. Koday is a dental consultant for the Teaching Health Center Planning and Development Technical Assistance Centers. So welcome, Dr. Koday and Dr. Duncan. We're thrilled to have you here today, and we'll turn it over to you for a presentation.
Okay. Can you hear me now? I was having a little technical difficulty. Okay, perfect.
Yes, we can.
Right. Okay. So today, do we have the slides up? Okay, there we go. Today, Dr. Duncan and I will be talking about the impact of teaching health centers on oral health in rural America. Both of us will touch on very similar points, but I will discuss the impact from the perspective of the community health centers, while Dr. Duncan will talk about dental residency's effects on patients in the community. And next slide. So these are our objectives, to learn the advantages of community health centers, to develop its own dental residency program, to understand the effort required and help available in developing a residency, to understand the impact of rural teaching health center dental residencies can have on patients and community at large, and to appreciate the influence of a mission-centered residency training on a dentist's future career. This is a very complex subject, and in the time we have, the best we can do is just sort of brush over the basics. It's important to know that there are a lot of resources available now to help programs get started and even help you in your deliberations on whether to start one or not. So I said, just keep that in mind as we go on. Next slide. I think the first step is to understand what a teaching health center really is, and I've included a definition out on your screen. Essentially, it means any primary care residency program that operates in a community-based ambulatory patient care setting. Certainly my experience comes from a residency program that we developed back in 2006 in a federally qualified health center. So I will be referring to health centers throughout my slides, but as you can see from the definition, this is not limited just to FQHCs. The main point I want to emphasize is, and I think this is extremely important to understand, is that once you have a residency in a health center, you are no longer just a facility that delivers care to the underserved. You are also a teaching facility. And that does change a great deal about the health center itself. While residencies certainly will fit into your mission, and if done well, will actually enhance your mission, it's really critical to understand that they will be in addition to your mission. So it is a big change, and one that you need to know. Next slide. There are four types of dentists that I certainly have seen come into health centers. The first is the dentist right out of school, and that's the dentist that is the least trained, and they're newbies. They really have just got I think a bare minimum training in dentistry. You can luck out and you get a seasoned dentist from the private sector, but even those dentists, they understand the private sector really well, but they don't understand the finances, in many cases, the types of needs that our patients have. You may really luck out and get a seasoned dentist from another community health center, but as the saying goes, if you've seen one health center, you've seen one health center. We're all different. We have very many a lot of similarities. There still are a lot of differences, including the culture of the clinic that the new provider would need to get used to. And unfortunately, there are dentists that don't seem to fit in anywhere, and they don't seem to last long. But the thing to understand is that all new providers take time to get up to speed, some much more than others, and they will need time to get used to the health center itself, our patient populations and our patients' needs, and the clinical skills required to meet those needs. All of this takes time, and then unfortunately, they often leave. So, every health center has seen that revolving door. So let's talk about why a health center should consider sponsoring a dental residency. So one big thing to understand, and I know all dentists do, but non-dentists may not, is that current dental education is not meeting the needs required of dentists serving in health centers. There is very limited or no training at all in population oral health. And I think as the future goes, as we go into the future, population oral health and prevention is going to become, actually that's the key to health, much more than what we're able to supply right now. So having no knowledge in that is not very good. Certainly they have very little knowledge in integrated healthcare. At best, they can have some idea of how EDRs, EMRs work, but very little outside of that. Very little training in cultural competency. The actual specific skill sets required in a health center, such as emergency dental care, surgical extractions, molar root canals, any root canals, in fact, complex pediatric dentistry, those type of things. A new dentist is not going to have those skills, and they're going to learn them on the job, unfortunately. Those are the kind of things that they will, they will have to learn in a health center. And most important is how to treat complicated oral health conditions in people with little ability to afford that care. Again, that's training that is usually not seen in a health center. The other things is that research shows that providers that are trained in rural health settings tend to seek those settings to eventually practice in. So residencies do develop a pipeline for recruiting dentists into our programs. They find out that our communities are actually nice places to live in, that our patients are good people that truly need their care. And they also find out that health centers can be great places to work. None of these things are very obvious to a new provider unless they have actually had work experience in health centers. When you think about it, most dentists are trained in urban areas, and they're trained in urban areas that are they're trained to, if they can't do something, automatically refer to a specialist. And in our community health centers, that even in community health centers in urban areas, unfortunately, those referrals are not possible. The other thing is, in all honesty, most dentists like to do a variety of procedures. So to develop a residency program, you may need to expand the services you provide your patients. I'll talk a little bit more about that in another slide. But when you think about it, if a prospective dentist is looking at two health centers and one of them allows a limited number of basic services, while the other one allows them to do a more expanded list of services, most dentists will prefer the health center with the expanded services. So and not only will they pick that health center, but they're more likely to stay longer. And I know that we've experienced that in my health center. We had pretty much a revolving door, and the residency did stabilize our staff quite a bit. The reason is that the residency sets you apart from the crowd, and it helps you in both recruitment and prevention of providers. So it will also, as I mentioned, because you're increasing the types of procedures, and you're not increasing it a lot. It's not, you're not turning your health center into a Crown and Bridge program, but you are able to expand more of those services than most health centers currently do without a residency program. So that's a good thing for your patients, and certainly Dr. Duncan will be touching more on that. It also, as I mentioned before, it improves your ability to provide specialty services, not only in-house, but also because you're expanding your contacts with other dentists and specialists, it increases your ability to refer your patients. The next point is really important. If structured correctly, it will improve productivity, maybe even income. I say maybe because most dental residency programs, particularly for the types that will end up in a health center, you concentrate mostly on adult care. And as you know, even blue states have limited amount of services that are payable by Medicaid. And obviously with the adult population, you have more uninsured patients too. So more productivity, as you know, doesn't always mean increased income. We see a lot of programs that think, okay, we're going to put a residency program and all of a sudden we're going to have more providers and this is going to increase our income. And you know, that is not the reason to start a residency program. It does increase staff professionalism because you are developing the staff more. You're looking at, you know, different types of training for them, and they are faculty, and I'll talk a little bit more about that too. It will increase the reputation of your health center in your community and your state dental profession. Again, it sets you apart from other health centers. And I really think that residencies are the future, part of the future evolution of health center movement. You know, health centers, you know, when you look at them, they're increasingly adding medical and dental residencies, dental and medical assistant training programs, nurse practitioner residencies. Some are partnering with dental hygiene training programs. All of this, they're doing this in the effort to recruit and train skilled providers, providers that, you know, understand their population and enjoy working with them. I really think I've been in the, I just recently retired from my health center after about 37 years there. And I really think this is an incredible time in the health center movement, because if you can dream it, you can very often find a way to do it. Next slide. I think the absolute most critical element of developing a residency program is the desire and mission of the program's leadership to be a teaching facility. If the leadership has not bought into this, your residency program development efforts will fail. There is no doubt about that. While starting a residency is hard work, it's not impossible work, and any program with the right desire and mission can actually do this. I know when I formed my program back in 2005, we started our first resident class in 2006. And I'll be very honest with you, I did not have any background in education outside of being a student. And I definitely did not consider myself an extraordinarily skilled dentist, especially in advanced procedures. But my program and the leadership of my health center had the grit and desire to develop the program. So we did. And so I said, don't feel you need to be anything, you know, really special. It's a matter if you're going to put the effort and really push to do this. And it could be a lot of fun. It's also important to understand that this is a lift for the entire health center. This isn't a side project. It isn't a dental project, dental department project. This is a large lift for all departments to one extent or another. And it does need project management. All of us, you know, when you think about it, all of us working in health centers are already extremely busy. And then you add another large project to already busy people. And that's why it makes everything so difficult to do. Not impossible, it just makes it difficult. And that's why the will and desire becomes really critical. Now, Koday is the dental residency accrediting body. And Koday requires that the sponsoring organization, which in my case was my health center, and that's typically as a health center, the health center itself needs to be accredited by a CMS approved accrediting body before it can even apply for Koday residency accreditation. So this means that your health center would need to be accredited by an organization like the Joint Commission or AAAHC. There are a few other ones as well, but those seem to be the main ones that most of the health centers go for. And obviously, anybody who's ever been through a program accreditation knows that this is a lot of work. It is a good thing, I think, for your program. It does help you develop things that you may not be able to have without the accreditation process going on. But it is a lot of work. You will also need to create new positions. There's a residency director, there's a residency coordinator, there's certainly new policies and procedures that need to be developed as well. And all of this takes time and effort. Typically, we see at least a 2 to 3 year project to develop the program. So this is, again, big project, will take time, but it is doable. Next slide. You will need to analyze your dental program layout or your dental clinic layout and make sure that you have the right number of operatories and space to add residents. Well, this can easily be done with 2 operatories per dentist. 3 operatories just makes, there's a little more room, and 3 operatories make it a little easier to make the financial piece of it work a little bit better. But again, two is definitely doable. You also need to consider some space for classroom and increase workstation capabilities, but those aren't as big a deals. I mentioned it before that one extremely critical element is that you will need to provide a greater array of dental services that you might not be providing right now. This is required by Koday, and also your residents will want those services because those are the things that they haven't learned in dental school, or at least haven't learned very well. These include certainly crowns, bridges, molar root canals, and more complicated oral surgeries, just to mention a few. If your dentists aren't doing those procedures now, they may need extra training, and that's they have, most health centers have CE funding for the dentist, so you may they may need to find that. You may need to think in that 2 to 3 year period of recruiting different dentists as openings come up that have those skills. And you also have to remember that the dental assistants may also need training if it's a brand new, if you're doing molar endodontics for the first time, they'll need a little training on how to assist the dentist to do that. Again, you're not talking about turning a health center into any major changes. My residency program did not change the percentages of crown and bridge hardly at all. It's just that we allowed more of that to happen than we did before. And the other big lift is a residency program will need to develop both a didactic and clinical curriculum. Again, this is not easy to do, especially in a rural area, but it is very possible to do. And it's actually is nice because you really begin to network out with specialists and other general dentists that have those kind of skills in your community. I don't know if fun is the right word, but it actually could be a really good project to work on that'll really benefit your program, your dentist, and your patients. And like everything, funding is absolutely critical. So there are a number of potential funding streams available. My program started off with funding from Title VII grants. This is before the Teaching Health Center funding was available. There's also potential for state grants, particularly for facility expansion and improvements. When you think about it, expanding oral health access to underserved by developing a residency program can be an enticing thing to state legislatures. It can also get the interest of your state dental association. My program certainly did that in the state of Washington. The Washington State Dental Association became our ally in looking for increased funding. And they actually even offered initial funding to sponsor a resident. So again, this requires a lot of networking, but it's all of this is good for the health center. Another thing that actually I don't have listed, but you always want to remember, is that residents will generate income from the procedures that they do, and you will keep that income. Again, more productivity with adults doesn't always mean increased income, but if you can work the numbers right, that that will be solid income for your program. Teaching health center grants are now the main funding stream for medical and dental residencies in health centers. And next slide. The HRSA Teaching Health Center grants are available for operating residencies, and the place to go for developing a residency is the HRSA Teaching Health Center Development Grant, which is what's pictured on the screen now. Typically, the health centers I've seen are requesting around $500,000 to develop a residency program, and they get about 3 years to do this. So again, financing is not the big issue. It's the other parts that I mentioned that do make it a big lift. HRSA also sponsors the Teaching Health Center Technical Assistance Center based out of North Carolina, and that's the group I consult with that help programs that are developing both medical and dental residencies. And they actually provide a lot of tools, so it's not you don't have to reinvent the wheel by any means. Bottom line, it's a lot of work to develop a dental residency, but there is a lot of help out there available. And there are tremendous benefits for health centers. And as Dr. Duncan will now discuss, great benefits for your patients and community as well.
Good afternoon, everyone. Thank you so much, Dr. Koday, for getting us started in this discussion. I'm just going to get started right away. For this segment of the presentation, I really want to focus on the impact that a residency program has in rural areas, has on the community. I've learned that one of the best ways to discuss data is through stories. So allow me to paint a picture of the realities for many individuals in rural areas when it comes to their access to quality dental care. For this presentation, I will use the state of Maine as our example. There are 1.39 million people living in Maine. In 2021, there were only 510 practicing dentists in the state. So that's approximately 5 dentists to every 10,000 people. Looking at this map of Maine on the screen, the little dots indicates the low-cost dental clinics that are present in the state. So these are your CHCs, your FQHCs, your VAs, your Indian health centers, etc. When we look at the distribution of low-cost dental clinics throughout the state, they're clustered around more of the urban areas and along major highways and interstates. So this means that the average patient drives long distances to seek care. The average Mainer drives 21.3 miles each way, and a Mainer living in the more remote areas of Maine drives 60 miles each way for dental care. And these low-cost clinics are some of the only places in the state that accept state Medicaid, which we call MaineCare. And most private practices do not participate in state insurance plans. And it's mostly because of some very, very low reimbursement rates. So we're talking about a community that really has to struggle and put out a lot of effort and gas money. And that's even assuming they could afford transportation, that they even have access to a car or vehicle or buses just to seek care. So that really, really shows the extent of lack of access to care that these patients deal with. So next slide. So in the last slide, I mentioned that there were less than 600 dentists practicing in the entire state. But if we look at it by specialty, it's even less. We're talking 23 endodontists in the entire state. Those are root canal specialists, 31 oral surgeons, 3 of which retired this year, 38 orthodontists, 12 periodontists, these are gum specialists, and 23 pediatric dentists. Again, there are 1.39 million people living in Maine. So access to dental care is a real problem. Next slide. So I really want to make a case for THCs, more specifically dental residency programs in areas like these. In Dr. Koday's presentation, he mentioned the benefits of having dental residency programs in your health centers. So I'm just going to stress that point a little bit more. For those of you that are unfamiliar with dental residency programs, we have GPRs and AEGDs for general dentists. GPRs are general practice residency programs, and an AEGD is an advanced education in general dentistry. These are intense and robust training programs. In my program, we created what I like to call a super dentist, which just means you're a dentist that can work anywhere and in any setting and be successful. We're creating a dentist that can go to rural Alaska or Timbuktu, and you're capable of treating any issue that could possibly come through your door with confidence, which is key for providers in rural areas. You want them to be able to handle whatever without the need to refer on a regular basis, because there's really nobody to refer to if you look at the numbers we talked about before. We are training dentists to be primary care providers, right? Being able to be a one-stop shop, do a little bit more than just what we think dentistry is, expand that scope, including some basic medical care as well, because a patient is driving all of those miles. I mean, if they need a vaccine, we should be able to give it to them too. So we're really integrating healthcare, right? So for a dentist to be able to be trained to that level, we're really having them operate at the highest end of their scope, which includes intense specialty training. Next slide. So the idea is to retain these practitioners in rural areas so as to increase access to care and the quality of care available to the community, as well as residencies being a pipeline for doctors into the state, as Dr. Koday mentioned previously. So for the patients that are driving 40 miles to 120 miles total per visit, coming into the dental clinic and being able to get all the care you need in one place without unnecessarily being referred is ideal. And it also increases the patient satisfaction because they aren't getting lost into the referral abyss. I don't know if you've ever gotten a referral from your doctor's office and you're calling, and months go by before you get seen by the specialist. I call that the referral abyss, which means you're just in the middle of nowhere with nothing and no hope, right? And this is what's happening to a lot of these patients in rural areas. And like Dr. Koday mentioned, having a residency program increases the scope, expands the scope of what that dental clinic is offering, and those patients are able to benefit from that. And they're able to get care quicker and more efficiently with less visits. Next slide. So we can't have a residency program without residents, right? So I know when we're thinking about structuring a residency program and all the benefits, you know, we have to remember that in education, our goal is education, to educate. So the residents matter, and it has to benefit the residents as well as the health center and as well as the community. So how could this benefit the resident? If you're thinking about the impact of the residency program, we want to know how it impacts the residents and how they practice moving forward post-graduation. So one thing about me, in addition to quantitative data, is all the numbers and all of that, I'm also interested in qualitative data. What do those numbers mean? How are these people feeling? You know, what are the patients' perceptions of us? How do they feel when they leave our clinics or interact with our staff? In this presentation, we're going to talk about how the residents perceive their experience while training in a rural health center. How confident do they feel in their practice of dentistry post-graduation? Their readiness. Do they end up in rural areas? Do they continue a career in public health? Why and why not? And I'm also going to share some of their stories. So let's talk about recruiting a little bit. You know, you say you get the funding, you get your program set up, and you're recruiting for applicants for your program, right? If you keep the idea of pipeline, right, in mind, you really want to be strategic in how you recruit dentists, right? You're recruiting, you want to focus on increasing the rural exposure of prospective dentists and addressing the social and personal factors that influence decisions both to enter and remain in rural areas. And I have some of that here on the slide. You know, when they're coming for a residency program, they want to make sure that what they're going to learn is more than they learned in dental school, right? If they come into a rural area, is they hiking? Can I go to the beach? You know, what am I getting out of it, right? And obviously being mission oriented and patient centered. And of course, who wouldn't want to be a super dentist like I described before? So you want to choose residents that are mission-oriented, have a history of volunteerism, are from rural areas themselves, or from underserved communities, because these are the type of providers that tend to want to stay post-graduation. Yes, you want the best and brightest, but you can choose the best and brightest that also have a desire to serve with compassion and maybe want to be in a rural area. And this increases the possibility of retention and integration into the communities post-graduation. Out of each class that I've had in my program in Maine, about 25% of each class remained in Maine to practice for at least a year or two. Some still live there and make up the dentists that make up the community right now. Next slide. So I wanted to share some of their stories and really make a case for the type of doctors that these programs produce, and I feel like the impact that these programs have on these residents serve more than just increasing access to care. It's increasing the quality of care that's being offered, okay? You're getting the opportunity to have a dentist that can really, really do good work and do good things and has ethics, So let me share some of the dentists that I've trained over the past couple of years. This first resident, I was really surprised by the feedback that she gave me in the survey that I sent out to them. When she was one of my residents, I really didn't think she was happy. I didn't think she was enjoying it. I really thought she hated the rural areas. She came from Canada and, I thought she was really struggling. But post-graduation, I was most surprised by what she's currently doing. She's working in a rural clinic in Alberta, Canada right now. And I was shocked because I really thought she was going to do the city life, but the impact that training in Bangor and training in Maine that she received changed her perspective on how she wants to practice. She's even applying for a 21-day government service to Nunavut. And this is what she said: I feel rural communities are really underserved and they lack a consistent doctor. Patient exposure is good. The variety of work, patients don't go shopping around, and the patients are really nice. You really feel that you are making a difference by helping them. And people there really need help. And it's a good way to see areas in Canada that I will never go on my own. So, there are benefits all around. Next slide. And this resident currently works in a private practice setting in suburban North Carolina with plans to apply to a specialty program. And this is her story. I would say my training changed my perspective on how to reach people who might not otherwise understand the implication of their oral health on their overall health. In terms of clinical skills, I would say I have more willingness to do extractions. In private practices in my area, there are so many GPs, which are general dentists, that refer out for any tooth that isn't periodontally involved. I learned more about managing the medically complex patient. I am more creative in my approach to working within the confines of finances. I always present good, better, best treatment plans and work with the patient, keeping them informed. Next slide. And this resident currently works in a corporate office in a rural area in Texas. She says it laid down the foundation of how I practice today. Practicing in a rural setting gave me a set of experiences that would be hard to get otherwise, especially during a pandemic. From that experience, I learned to get a thorough health history from patients, and I'm cognizant of carpal count, which is your local anesthetic, and know how to buffer anesthetic. I gained so much experience in endo, those are root canals, and oral surgery that I do a lot of surgical extractions and molar root canals these days. I'm really glad that I can serve that community. By serving that community, I gained valuable experiences that helped me serve my patients today. And then she ended it off by saying, they are not just my patients, they are people first, and I make sure to treat them with respect. I always operate by the golden rule, which is do unto others as you'll have them do unto you. Wouldn't you want a dentist like this? So when we're making a case for these residency programs, we're not just talking about funding and money and all of this stuff, but the effects and the impact of these programs can be felt in any area of the United States or anywhere in the world, because we're creating dentists who have a heart to serve, a compassion that understands their patients, that aren't money hungry like a lot of people want to believe about us, right? But that really, really, really understand mission and really are tuned into the needs of their patients, not just their mouths, but their entire lives, So we're really creating a product that nowhere else can, So if you're considering this, there's so many different things that go into this. Dr. Koday mentioned at the beginning, we could only tell you a little bit more about it, a little touch about it. But if you're looking at what your legacy would be as an educator or as a dentist who is retiring, once you want to know that there are dentists, hundreds of dentists all over the world who are now practicing at the highest level of their scope and who are really impacting patients' lives and changing lives and doing good and no harm to people. Next slide. So I really hope that I made the case for you to think about, having a residency program at your health centers or VAs, etc. And in conclusion, just going over our objectives today, I hope that you learned the advantages for a community health center to develop its own dental residency program. I hope that you now understand the effort required to help help available when developing a residency, and also understand the impact a rural THC's dental residency can have on patients and community at large. And if you can appreciate the influence of a mission-centered residency training on a dentist's future career. I thank you so much for your time, and I really hope that I made a case for dental residency programs. Jade.
Thank you so much, Dr. Koday and Dr. Duncan. Those were wonderful presentations, and you have certainly convinced me, Dr. Duncan. Zufall did receive a Teaching Health Center Planning and Development grant last year, and we've been working on getting that program set up. But I think this is good, inspiring thoughts to keep us going on that process. I'd just like to invite the audience. We have a good sized group of participants. I'm sure there are some questions out there. So please put those into the Q&A. We'll be happy to address those. I know we have a couple of comments in the chat. The holistic benefits is clearly evident. Folks appreciating the fantastic testimonials and comments from some of your students. And yes, we will share out a copy of the slides so folks can continue to look at those. In the meantime, while folks are thinking perhaps of some more questions, I'd just like to start a few, and I don't mean to bring it down, Dr. Duncan, from where you were, but what are some of the challenges that you both faced in running these programs? I know that Zufall has faced some in getting ours set up. So if you could speak to that for a minute.
So I guess I can go first. The biggest part for the health center itself is the sponsorship required by Koday. That's that they're required to be accredited by a CMS sponsored organization. The next things are finding the right faculty, making sure you have the right procedures on board, and then curriculum development, I guess, maybe to listen. I don't know. What do you think, Dr. Duncan?
For me, I think the biggest challenge is making sure that the support from your sponsoring organization is thorough, especially through this VUCA environment we're surviving in with the pandemic that just happened and is still happening. You really want to have that backup, because sometimes the money might be a little short and you may need some additional help, especially with equipment and, and materials and stuff like that. So if they're really cued in and understand the mission that education does matter too, and not just the revenue, you tend to get a little bit more success out of it.
Absolutely. Thank you. We do have one question in the Q&A. What are the benefits of having a residency program versus having a dental student outreach program? With a comment that it seems like a lot more red tape and work needed to get the program developed. So again, thinking about some of those challenges, why the benefit? Why to push for a residency program?
I can take that one first. I think both great ideas. I think the earlier you expose dental students to rural areas, I mean, I could even make the case for building a dental school in a rural area to begin with, right? Because then that will start the ball off, rolling really fast. But I think you should start there. Of course, if you have an idea of starting a residency program, start with a community outreach, be a site for a dental school that may be in your area or in your state. When it comes to the dental residency program, we're talking about an elevated level of training, right? So it's a little bit more than what you learn. I call dental school dentistry 101, an introduction to dentistry. When you leave, you have a paper that says you can spell the word dentistry. That's it, right? So your practice of dentistry is where you learn dentistry. And all residency does, it just kind of front loads a lot of that information. And then you still have a lot more learning to do after. But having something like that in a community that doesn't have access to anything more advanced than a screening or getting a free toothbrush, I think there's a lot more benefit for the patient themselves.
I would also add that the time that we had a lot more. We still have students in our program, but we had a lot more before we had the residency program. But they were only staying for 2 weeks at a time. I know there's dental schools that have them out there 6 weeks and maybe more. But when you think about it, you have a resident there for a year. It's like a working 1 year job application in many ways. They get to understand your program a lot better, and you get to understand them. I know we were able to recruit far more dentists from our residency program than we were from our student program.
Very good. Thank you both. And speaking of recruiting, how about faculty? What has been effective to recruit faculty to teach or work for your programs? Because obviously we need to recruit the residents, but we want to have the right faculty there to teach them.
So I'll start. When you're beginning, I look at my program when it first started and where it is now, and it's just light years apart. So, you're most likely going to have a bare bones residency program to start with. So you'll have, as you're developing the program and you have openings, you're going to want to look for dentists that, can do more root canals and can do, some of those other skills. And you'll want to network a lot with the private sector, the specialists. And we did very small asks, can you supply one lecture? And just because if you ask the big asks, usually they'll say no. And so once you get the initial faculty there, the rest of it becomes much more easier, because then you begin to recruit former residents, and the community gets used to you being there, because they're all going to be suspicious, what's this community health center doing developing a residency program? But it kind of snowballs after a while, and then you start getting, we've even had people call us, interested in helping out.
That's great. Dr. Duncan, anything to
I
add?
agree. Yeah, I agree with Dr. Koday. And what's surprising is that getting faculty is not the most difficult ask at all. You'd be surprised how many dentists out there are dying to pour what they know into somebody else, right? To the point where you'd have them volunteer their services. You don't even have to pay them. Some you do, some would do it for free, especially those that are retired and don't want to be at home. They want to come, and they would gladly give their services. So I don't think that's much of a struggle. It hasn't been for me at all.
That's very encouraging. Could you both talk a little bit about the sustainability of the programs? I know Dr. Koday talked about some of the long-term funding issues, and what are either creative ways that you both have found to keep those programs going, or issues that you've come across with keeping it sustainable?
In my program, I guess to start, before you consider a residency program, you'll want to look at what your financial, bottom line is for your dental program. If you're able to sustain it reasonably well, ideally without grants, but certainly, with grants, this will just be an extension of that. So, kind of give you a clue. So as I mentioned, you don't want to look at this as some gold mine that you're going to be making money off of. But you will, the more efficient you can make the program, the better the income will be. And the residents need to be taught efficiency. You can't go to the point where you're making the program, you're stressing efficiency over education. You always have to keep education of the residents in mind, but those two concepts can blend in well. And the only other thing outside of the basic grants, I would emphasize again, networking and state legislatures for program facility or facility improvements and things like that.
I would agree with Dr. Koday, but I would also want to flip it a little bit, not just worrying about the sustainability of the program, but the sustainability of the dental services could be a result of the residency program, especially during the pandemic. We saw that the residency program was the only reason our doors were open. So that actually, the benefit of that, you can put all the resources into a residency program that's already funded, right? So it's not drawing too much out from you. So I would just add that flip there, that one of the benefits is that you will always have providers, because especially if it's a well-structured program, they will find you like they found me in the middle of nowhere, Bangor, right? So they'll find you.
Absolutely. Thank you both again. We have a few more minutes for questions. Just reminding folks to put anything into the Q&A. If you've got something that you'd like to know, you've got two. I will say there are not a lot of teaching health center dental residency programs in the US. So you have two of the experts right here in front of you. So please, take the opportunity and ask any questions that you'd like to. I know, Dr. Duncan, you gave some great examples of successes and outcomes from some of your residents. Are there any other additional successes that you would like to talk about? And also the same question to Dr. Koday, successes or positive things coming from your program, either for the health center or the residents?
Dr. Duncan, you want to go first?
Oh yeah, sure. For me, success will always be, the outcomes for the residents, right? Their success is my success. But in addition to that, I would measure the success of the program by how many dentists that pass through our program practice in the state of Maine. And there are many, right? And some of the specialists started off through our GPR and our AGD program. Some of the pediatric dentists started off at our pediatric residency program when we had that, and stayed on, moved their families up to Maine and stayed on, and really are shaping the community, the dental community in our state. So I think that's really a huge success. It's like a legacy builder,
And I would add that the care, I know the care my program was able to offer our patients is far greater now than it was before. We have, for instance, just a couple examples. We have a endodontist now that comes in and actually not only works with the residents, but works with our faculty in developing their skills. And we deliver some really great molar endo. We had an international resident that came through that was an oral surgeon from India. This guy is incredible. He can work on my teeth if I need an extraction any day of the week. There's certain state requirements, but basically in our state, they needed 2 years of a residency program. So he did a second year with us. He's now an oral surgeon in our program. Never would have had that before the residency program. And our current director, I just retired from the position, but our current director is a former resident and with incredible skills. So yeah, it's what they, to me, it's the care providing patients you can expand that. We don't have to refer as much as we used to.
Mm-hmm. Absolutely. And sounds like the new director, Dr. Koday, has a clear appreciation for the value of the residency program because of their experience going through it.
Yeah.
That's great. One last question, and I'll just remind folks to please take a look at the survey link if you're looking for continuing education credits. The link is in the chat. Please take time to complete that. And I'll have one last question from me. What is the most important piece of advice that either of you or both of you would give to a health center considering starting a dental residency, or or a couple pieces of advice if you've got them?
And I would say seek help. So, certainly I know Dr. Duncan and I are, certainly could be available. There are organizations, the one I mentioned, the Technical Assistance Center. But yeah, don't reinvent the wheel.
Agreed. If you need a curriculum, reach out to somebody. There's no need to make stuff up, you don't have to struggle. We are really a community, like Jade said, there are not many THCs that have dental residency programs, and even less right now. So reach out to any of us and we're available. That's how I met so many people that I currently know now. They just randomly emailed me asking for help about how do they apply for their grants. And we became friends just from consultations and stuff like that. Just reach out. And my best advice would be really try to be strategic about how you incorporate the residency program. Make it part of your strategic planning. Don't just have it as an aside. Incorporate it into your mission, and don't just check a box with it. Really maximize the benefits that it can have for your program, for your center, and really give it its space to grow. Yeah.
Thank you both, and I would certainly echo that. I know our experience at Zufall has been tremendous when reaching out to connect with folks to give us advice and to help us through the process. I would also say that I think Zufall, among the group of folks that got the planning grants that HRSA has offered, and there is an application open now for the next round. I think the deadline is fast approaching. I believe it's December 12th, but that has been an asset that we've had that I know Dr. Duncan and Dr. Koday didn't have when they were starting their programs, that HRSA is providing support to do the planning and design and development, because it is such an intensive process, from that agency accreditation that Dr. Koday talked about, the CODA accreditation, the development of the curriculum, et cetera. And as you said, Dr. Duncan, to really make it intentional and tied in with the mission of your health center. So I think it really is an asset to be able to have that time to do that planning and development correctly. So thank you both tremendously for your time and your insights and your thoughts today. Just a reminder, and thank you folks for the very positive comments in the chat. We appreciate them. Lots of comments, Dr. Duncan and Dr. Koday, on the excellence of the presentation. One question about how we could find out who else is